Welcome to the Creative Commons RX podcast. Before diving into this episode, I want to ensure we're all on the same page. This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.
Hello and welcome. Today we're diving into one of the biggest, most revolutionary shifts happening in medicine right now. It's a total rethink of how we make the very drugs that heal us, moving away from simple chemistry and into the world of complex biology.
Seriously, forget what you know about pressing chemicals into little white pills. We are in a whole new era. The medicine of tomorrow isn't just mixed in a beaker. It's grown, it's engineered, and it's even harvested from living systems.
So to really wrap our heads around this, you have to understand the tale of two medicines. You've got your old-school, traditional synthetic drugs, and then you have this powerful new class of drugs we call biologics.
And the first big difference is just scale. It's staggering. On one side, you've got a small molecule drug like aspirin. It's tiny, it's simple, you make it with chemistry. But biologics? They're giants. We're talking huge, complex proteins that are grown inside living cells. And because they come from living things, they're not all perfectly identical. There are tiny natural variations. This isn't just chemistry anymore, folks. This is pure biotechnology.
And that massive size totally dictates where they can work in the body. You see, a small molecule is like a tiny little spy. It can sneak inside a cell and mess with its internal machinery. A biologic? No way. It's way too big for that. It has to work on the outside, acting more like a super-specific key that fits one and only one lock on the cell's surface. It blocks bad signals before they can even get in the door.
So what does this actually mean for patients? Well, it's a game changer. Because these molecules are so big and complex, they hang around in your body for a really long time. We're talking weeks, sometimes longer. So instead of remembering to take a pill every single day, you might get an injection once every few weeks. It's a completely different way of thinking about treatment.
Okay, so if these drugs are so big and so specific, what are they actually targeting? Well, a lot of the time, the target is our very own immune system. And to really get how these smart drugs work, we need a quick tour of the body's internal battlefield. This is where biologics do their most important work.
Think of your immune system as having two main armies. First, you've got the innate system. These are your fast-acting first responders, the grunts on the front line that attack anything that looks foreign. Then you've got the adaptive system. These are your special forces, your T cells and B cells that are highly trained to recognize a specific enemy, take it out, and then remember it for the rest of your life.
So how do all these immune cells talk to each other across the battlefield? Well, they send messages using molecules called cytokines. A cytokine is like a dispatch, a written order. And the JAK-STAT pathway? That's kind of like the mailroom inside the cell. When the dispatch arrives at the cell surface, this pathway zips the message down a chain of command, all the way to the nucleus, the cell's HQ, telling it exactly what to do. Biologics are designed to be master spies that can intercept, block, or even rewrite these messages.
All right, now that we've mapped the battlefield, let's meet the soldiers. And this isn't just one type of drug. Oh no, it's an entire toolkit of highly specialized biological weapons we can deploy against disease. First up, you've got the superstars of the group, monoclonal antibodies, or MABs for short. These are by far the most common type of biologic, and what they are is pretty amazing. They're basically lab-engineered antibodies that act like heat-seeking missiles, designed to hunt down and lock on to one specific target in the body, whether that's a cancer cell or a protein causing inflammation. And just look at the range of what these things can do. You've got MABs that block a molecule called TNF-alpha to treat things like rheumatoid arthritis. And then you have these revolutionary cancer drugs, the checkpoint inhibitors. Get this, they don't even attack the cancer directly. They find your T cells and just release the brakes, letting your own immune system go to town on the tumor. Incredible! Next up in the toolkit are fusion proteins, and this is where the engineering gets really clever.
Scientists literally take the business end of different proteins and stitch them together to create something totally new. A really popular trick is to create a decoy receptor. It's basically a molecular trap that floats around your system, soaking up all the bad signals before they can stir up trouble. And then there's CAR T-cell therapy. This might be the most mind-blowing of them all. This is where medicine gets truly personal. Doctors actually take your T-cells out of your body. They genetically reprogram them in a lab with a new cancer-seeking GPS, and then they infuse them back into you. They become a living drug, a personal army of super soldiers engineered to hunt down and kill your specific cancer. It's just wow. But, and this is a really big but, when you use tools this powerful, when you are literally hijacking and redirecting the body's own defense systems, you're dealing with a whole different set of rules and risks. This is not your typical may cause drowsiness fine print.
Take a look at this. With one of the new anti-amyloid drugs for Alzheimer's, a staggering 35%, more than a third of patients on a high dose developed a specific kind of brain swelling. And why? Because the antibody was doing its job too well, pulling amyloid plaque out of brain blood vessels and causing them to leak.
But here's what's so important. These risks aren't just random. We're starting to figure out who is most vulnerable. And a huge piece of the puzzle is your genetics. Carrying a specific gene variant, APOE epsilon 4, dramatically shoots up your risk for this very side effect. And that really is the key takeaway here. The side effects you see with biologics are in a different category. They aren't just an accident, they are the direct, logical consequence of a very powerful drug successfully manipulating an unbelievably complex system, our own immune system.
You know, this whole evolution has even forced us to change the rulebook. Take insulin. For decades, regulators treated it like any other chemical drug, but now it's officially classified as a biologic. And why does that matter? Because that one little change opened the door for something called biosimilars, which are basically the biologic version of a generic drug. That helps bring down the massive cost and make these amazing drugs available to more people. So when you put all these pieces together, it points in one crystal clear direction. The more powerful and complex our medicines get, the more personalized and precise our approach to using them has to become. This right here, this is what the future of medicine looks like. We're using genetic markers, like that APOE gene for Alzheimer's patients, to make smarter decisions. It's not just about finding a drug that works anymore. It's about finding the right drug for the right patient at the right time, carefully balancing those incredible benefits against the very real risks, all based on their unique, individual biology. Which leaves us with a final, really crucial question to think about. We are literally engineering drugs from the blueprint of life itself. So the challenge ahead isn't just about what these drugs can do for us, but about how we, as doctors, as patients, as a society, must re-engineer our entire approach to medicine to responsibly handle their incredible power. Thanks for joining this explainer.
This is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient or pharmacist-patient relationship is formed. Using this information and the materials linked to this podcast is at the user's risk. The content on this podcast is not intended to substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Clinical experts created the references, content, and clinical insight. NotebookLM, a Google AI tool, created the audio content, which I extensively reviewed before release. Finally, the host states that he takes all conflicts of interest seriously. Currently, there are no conflicts to disclose. For all of his disclosures and the companies he invests in or advises, he directs users to reach out independently, where he keeps an up-to-date and active list of all disclosures.